Sickle Cell Anemia, a presentation by Jasmine Brunson. Learning objectives. Review sickle cell disease through case study. Discuss assessment data as it relates to sickle cell disease. Discuss lab values as it relates to sickle cell disease. Discuss priority nursing diagnosis and nursing interventions. Review patient teaching. Evaluate learning with Kahoot. Matthew Jones is a 21-year-old African-American male. He has a history of sickle cell disease, which is an inherited red blood cell disorder that causes the cells to be misshapen and break down faster. The inherited trait is known as hemoglobin S. Matthew and his secret boyfriend got accepted into different colleges, which led to a breakup. He became depressed and started partying every weekend, where he was frequently exposed to alcohol. In order to fill the void and feel love again, he joined a fraternity. He was peer pressured into drinking excessively at frat parties and started to experiment with other drugs such as marijuana. The morning after a party, Matthew woke up with excruciating pain in his back, abdomen, arms, and legs. An ambulance was called and he was sent to the hospital. Upon arrival to the ED, Matthew shouted at the nurse, "Make it stop. It feels like someone is stabbing me all over." The patient also complains that he is having trouble catching his breath. So, what do you think is happening with this patient? A. Alcohol poisoning. B. Sickle cell crisis. C. Appendicitis. Or D. He's having a manic episode. The answer is B. Sickle cell crisis. The rationale: the patient is experiencing a sickle cell crisis. He has a history of sickle cell disease, and with his recent activities, it caused him to go into a crisis. From the case study presentation, which activities do you think caused Matthew to enter a crisis? Select all that apply. A. Break up with his boyfriend. B. Excessive drinking. C. Joining a fraternity. D. Walking to class. Or E. Smoking marijuana. The answer is A, B, and E. Breaking up with his boyfriend has caused him emotional stress, which we know stress can stir up a crisis. Alcohol and smoking may also trigger a sickle cell crisis. Joining a fraternity would not cause a crisis, and walking to class is not a strenuous activity, therefore it did not contribute to the crisis. Matthew has been taken to the emergency department. What assessment findings do you think the nurse will find? Select all that apply. A. Yellow sclera. B. Cool, clammy skin. C. Dry skin. D. Cyanosis. E. Red rash on cheeks. The answer is A, C, and D. The red blood cells are breaking down faster and they release bilirubin, causing jaundice in the patient. The patient's skin will not be clammy. Instead, it will be cool and dry from dehydration and decrease in blood. The red blood cells are sickled and not providing the necessary amount of oxygen to the body, so cyanosis may be seen in the fingers and toes. Red rash is not a sign of sickle cell crisis. Assessment findings. As the nurse assesses the patient, she notices cool, dry skin, poor skin turgor, pale, dry mucous membranes, chapped lips, cyanosis in the fingers and toes, capillary refill greater than 3 seconds, yellow tinting of the sclera. The patient's vital signs: temperature 100.2, pulse 124, respirations 24, blood pressure 100/60, O2 sats 91%. The patient's pain assessment is a 10 out of a scale of 0 to 10. Other findings a patient in the crisis may present: fatigue, weakness, organ failure, cold intolerance, severe thirst, edema, and an enlarged spleen or liver. Looking at the assessment findings, which finding would give the nurse information about peripheral circulation? A. Poor skin turgor. B. A pain of a 10. C. Temp 100.2 degrees Fahrenheit. Or D. capillary refill greater than 3 seconds? The answer is D. Body temperature, skin turgor, and pain levels will not give information regarding peripheral circulation. Change in capillary refill will indicate change in circulation. What labs and diagnostic tests do you expect to be ordered for Matthew? Select all that apply. A. CBC, B. LFTs, C. Ultrasound, D. CT and MRI, E. Bilirubin levels, or F. Reticulocyte count. The answer is all of the above. A CBC should be done to look at the 3 types of blood cells. In sickle cell disease, the RBCs are usually the main ones affected. LFTs should be done to determine the state of the patient's liver. Hepatomegaly can occur, or damage can be done from multiple blood transfusions. CT and MRIs should be done to look at other organs and bone structures of the body because blood flow can be blocked from reaching important organs. This could lead to things such as stroke, acute chest syndrome, and splenic sequestration, which is life-threatening. Bilirubin is being released at high amounts, causing jaundice. The reticulocyte count will tell us the amount of premature red blood cells being produced. Here I have highlighted the lab values of importance. The white blood cell count helps fight off infections. If the white blood cell count is low, it will be easier for someone to get an infection or get sick. People with sickle cell disease usually have normal white blood cell count, and in this case, it is within normal limits. The RBC's main function is to deliver O2 to the body. Hemoglobin lives on the red blood cells and helps them bind to carry oxygen throughout the body. People with sickle cell disease tend to have decreased red blood cells because they are being destroyed faster than they can be made. So in this patient, the red blood cells and hemoglobin are very low. Hematocrit indicates an insufficient supply of healthy red blood cells, and in this patient, they are extremely low. Platelets are responsible for clotting and are really high in this patient, which is important information because with sickle cell disease, they tend to throw off random clots. The NRBCs represent a very immature form of red blood cells that is released when the body significantly lacks red blood cells. The NRBCs are really high in this patient because the red blood cells are really low. The reticulocyte count is good, which indicates the bone marrow is doing what it is supposed to. What are some orders you anticipate from the doctor? Select all that apply. A. Administer IV fluids. B. Keep patient NPO. C. Monitor intake and output. D. Administer pain medication as prescribed. Or E. Keep patient in high Fowlers. The answer is A, C, and D. The patient is showing signs of dehydration and will need fluid resuscitation. Red blood cells stick together, so added fluids will help dilute the blood and help with blood flow. The patient should not be NPO. Instead, the nurse should encourage oral intake. Monitor intake and output because the patient is receiving a lot of fluids at this time, and if the kidneys have been affected, then a decrease in urine output would be one of the first signs. The patient will be in a lot of pain, so give them pain medication on time and stay on top of it. The patient does not need to be in high Fowlers. What seems to be priority for this patient? A. Pain management. B. Auscultating breath sounds. C. Administering IV fluids. Or D. Discussing his actions from the party. The answer is A. All of the options are important to care for the patient, but gaining control over the patient's pain is priority for a person in a crisis. Nursing diagnosis: impaired gas exchange, breathing pattern ineffective, acute pain, imbalanced fluid volume, decreased cardiac tissue perfusion, risk 4, ineffective cerebral tissue perfusion, risk 4, infection, risk 4. What are some of the nursing interventions the nurse may implement? Select all that apply. A. Encourage PO fluid intake. B. Administer IV fluids per provider's orders. C. Administer pain medication per provider's orders. D. Apply nasal cannula for oxygen therapy. Or E. Closely monitor patients' vital signs and tolerance to transfusions. The answer is all of the above. All of the above options are proper nursing interventions for a patient experiencing a sickle cell crisis. Encouraging fluid, IV, and PO are great for diluting the sticky blood. Giving the patient pain meds will keep them comfortable. O2 therapy is appropriate, and monitoring vital signs will let the nurse know how the patient is tolerating the blood transfusion. Nursing interventions. Encourage PO fluid intake. Administer IV fluids per provider's orders. Provide effective pain management. Apply nasal cannula for oxygen therapy. Closely monitor patients' vital signs. Auscultate breath and lung sounds. Monitor intake and output, and keep the room warm. Which of the following will aid to prevent thrombus formation? Select all that apply. A. Popsicles. B. Gelatin. C. Apple juice. D. Raw carrots. E. Broccoli florets. The answer is A, B, and C. Popsicles, gelatin, and apple juice all aid in hydration and will help prevent thrombus formation. Raw carrots and broccoli florets will not. True or false? You should provide patient teaching 20 minutes after pain medication is given. The answer is false. The patient is most likely going to be drowsy from pain medication. You should make sure you plan to teach the patient when they are not drowsy and alert enough to understand what they are being taught. You should also assess the patient's readiness to learn and observe their learning style. Patient teaching. Educate on what triggers crisis and what to avoid. No alcohol use, smoking cessation, no strenuous activity, reduce stress, and drink at least 8 glasses of water a day. Educate on medications, side effects to look out for. If going home on opioids, educate on the proper use. Educate on disease. Educate on other methods of pain relief, such as a heating pad, a hot bath, rest, and a massage. This is just a list of references from the PowerPoint. Now we will participate in a Kahoot. Graduate 2020, that's me. Okay, so first question. True or false? It is best to provide the patient with ice packs during a crisis. False. You should provide heat instead of cold. Which activity would be best for a patient with sickle cell disease? Walking. Walking. Everything else is strenuous. Hemoglobin is responsible for carrying oxygen throughout the body on white blood cells. That's false. It's red blood cells. Which is a possible life-threatening complication of sickle cell disease? Splenic sequestration. Which is inherited from the parents? Hemoglobin S.
name is Jasmine Brunson, and I hope you gained a lot of information from my presentation.